India, along with the deadly coronavirus outbreak, is also fighting a surge in cases of black fungus, and at least 90 people have died across different states in the country because of this infection. It's like an epidemic in a pandemic sort of a situation. The government, in fact, today on 20th of May, ordered all the states to declare black fungus as an epidemic. Now, to discuss this in detail, we're in conversation with Dr. Vijay Rangachari, Consultant-ENT in Endoscopic Skull-Based Surgery, Manipal Hospitals, Bengaluru. Thank you so much, sir, for taking out time and speaking to me.
You're
So,
welcome. It's a pleasure, Navya. Thank you for having me here.
absolutely, sir. Sir, to begin with, we've seen multiple reports. We've come across multiple reports. It's all very complex to understand, and we want to break it down for our audience to understand it better. What exactly is black fungus? What is this infection, and who are at risk of contracting this infection?
Okay. See, to start with, we are now facing a lot of cases of black fungus is a layman term. Technically, we call this as mucormycosis. So it is an opportunistic fungal infection. That means it is waiting for some area where it can go and attack the human being or the host.
Okay.
Okay. So what happens in mucormycosis? What happens in COVID-19? The body is suffering a respiratory tract infection. Okay, to begin with, the COVID virus enters the nasal from the nasal pathway up to the lungs, and
Hmm.
it is causing a lot of breakdown of the nose and throat linings. Number
Right.
one.
Right.
Then what happens is these patients are requiring various levels of steroids, and the steroids cause a lowering or reduction in the immunity of the body, so that the attacking power of the COVID virus is reduced and we are able to combat better. So, steroid intake, which then leads to a cycle of unregulated or increased levels of blood glucose.
Hmm.
Okay, so which we call as the diabetic mellitus.
Right.
Diabetes mellitus is one of the predisposing factors. Some of them who are already diabetic, they are already at risk of any infection. And many of the normal people, young normal people who have no history of diabetes, they also end up with high sugar levels. And this leads to what we call as a post-COVID iatrogenic diabetes, which is diabetes induced or produced in the patient because of the steroid intake. So when there
Okay.
is a diabetic condition plus steroid intake, and there is a high level of inflammation in the passages of the nose and throat, and this leads to colonization. The fungus is all around us. It is there everywhere. It is there in the environment. It's there on our table. It's there everywhere. But because our respiratory system and our immune system is intact, it is not able to attack us, and it's not
Right.
able to colonize and come and sit in our body. So the
Hmm.
moment these bacteria are broken down, diabetes itself causes significant, alkalinization. That is, the acidic pH of your body is converted to the alkaline range because of the high level of sugar in your blood, which percolates into your tissues.
Right.
So what happens is the breakdown of the protective barriers. See, why does fungus come in these places? The ear, nose, throat, and the skin, the eye, these are the places which are directly exposed to the external environment.
Yes.
Understood. So what happens is we have to clearly understand that these are the first layers of defense in our body. And when this defense is broken down by the factors which I told you, namely steroid intake, which causes a situation of diabetes, or the diabetes which is already there makes your tissues more alkaline and they break down faster, and tissue healing takes more time in a diabetic state. This we are
Right.
already aware of. Plus the factor of the prolonged oxygen intake in the patients who have severe COVID, that also causes significant abrasion or breakdown in the pressure because of the friction and other causes. And one important theory which has come now is high levels of inflammatory marker ferritin, which is an iron breakdown product, which is
Hmm.
very high in severe COVID patients, which is a
Okay.
marker of higher severity of COVID. So this ferritin, which is an iron compound, it serves as a nutritional product for the fungus to thrive and propagate.
Okay.
Okay, so high ferritin levels with diabetic status plus steroid intake plus breakdown of a primary protective linings of the nose and throat and the respiratory tract. These are the reasons why a normal fungus, which is all around us, is
Hmm.
able to colonize and attack and start propagating inside the body and leads to one by one every organ involvement, starting from the nose, the sinuses, the
Hmm.
eyes, sometimes to the brain, and sometimes to the lungs. So the whole tract gets involved, and this is the mechanism how mucormycosis enters our body, especially in the post-COVID recovery patients who have been subjected to these factors.
Absolutely. Doctor, with what you're saying, can we say that patients who are diabetic are at more risk of contracting this?
Yes, definitely those who are diabetic, number one, and those who have got diabetes with high sugar levels. There is a
Right.
category of diabetes which is well controlled. There
Yeah.
is a category of diabetes which is uncontrolled or poorly controlled. So they
Hmm.
will be the people who will be more at risk, and those who have required steroid intake, which alters the immunity and the immune functions of the body.
Okay. Now, one very common question, doctor, that we've got from a lot of viewers is how does one know if they have black fungus? Are there any early signs, any warning signs, any symptoms that one can look for?
Yeah, this is a very important question, and it has to be made clear both to patients as well as doctors who are
Hmm.
going to be seeing the patients who have recovered and they present in small clinics as well as regular hospitals. The
Right.
first and foremost thing is pain and swelling. Where all these areas where you can get pain and swelling, starting from the nose,
Okay.
blockage, any feeling of crust or bleeding in the nose, then swelling in the nose, swelling in the face, face, pain in the jaw, swelling in the eyes. Then comes the next double vision,
Hmm.
loss of vision, blurred vision. And if you go further, then you will start having spread to the brain, which is late stage. We should not wait till then. We should be
Hmm.
able to pick up in the early stages where most of them are presenting all around the face area, which may involve the nose, the eyes, the sinus area, which is the cheeks, plus the jaw area. Any pain, swelling, redness, or any changes in vision, these are all prompt signs to be without any failure. We should think of mucormycosis as one of the causes with the background of all the factors which we have seen
Hmm.
in post-COVID recovery patients. If any of these signs are seen, they should immediately be evaluated for mucormycosis possibilities and further treatment and diagnosis of the same.
Right. So, doctor, what exactly does the treatment constitute? Now, if someone has black fungus, when should they, approach a hospital or approach a healthcare center? Because of COVID, a lot of people are hesitating. They don't want to seek medical
Yes,
help. They
yes,
don't want
yes.
to go
See,
to a hospital.
so
Why is it?
we have
When does
to
it
be
become
aware
urgent?
first about the category of the patient who has recovered.
Hmm.
Is he falling in the category which we have described? Whether he was a diabetic who had high sugar levels and whether he had these kind of factors which predispose or give higher risk for mucormycosis. And if
Okay.
they are having any of the symptoms as I described, and they should be definitely visiting a good center where it can be diagnosed. And coming to the diagnosis, they will have to visit a ENT or an ophthalmologist,
Hmm.
or preferably both, depending on which part of the body is involved. Sometimes
Hmm.
even dental surgeons have been able to pick up and refer to us, and we will have to do a nasal endoscopy, which is an examination of the nasal linings, the interior of the nose, to check for any crusting or many black, particles being formed, or any mucus pus or any blood stain discharge, or any swelling in the nose linings, which then leads to
Hmm.
scar formation, which we call as eschar, or a black, thick scar,
Hmm.
which is
Okay.
a kind of a degradation product and breakdown. Once the normal pink linings of the nose start changing, it is a warning sign that something is happening which needs to be investigated. And
Okay.
what we do, we will have to do a scan to see the level of involvement, which may be a CT scan or an MRI scan or both, followed by a detailed examination of the nose, and we will have to do some kind of a debridement. That means we have to break down, scrape out all the dirty, fungal areas in the nose, send it for a biopsy, which will test and prove the type of the fungus.
Okay.
Subsequent to that, they have to be subjected to a prolonged course of antifungal therapy, which are namely, most importantly, which is running short now, is injection amphotericin, which
Yes.
is a antifungal injection, which has to be given on a daily basis for at least 4 weeks,
Okay.
and it has to be continued after the surgical cleaning of the nose, if required, even of the eye. Sometimes there have been cases where they have to remove the eye. It is so
Yes.
bad.
Yes.
Protect the life. So, life more than the eye. So this is the principle, because the fungus spreads very badly. If it goes inside the brain or the base of the brain, those areas, wherever we are able to see the extent of the fungus spread, we'll have to scrape out everything to clean up that area
Hmm.
and create fresh tissues there for healing. Plus, we will have to follow it up with antifungal therapy, which
Hmm.
is an injection amphotericin, which has to be given in an IV drip for about 4 to 6 weeks, depending on the severity and the improvement. We have to judge the progress.
Right. Doctor, as we know, black fungus is mostly seen in people who've recovered from coronavirus or COVID-19. So, do you have any suggestions for people who've recovered from COVID-19 and all the precautions that they can take to protect themselves from black fungus?
See, we will have to see in which category they are falling.
Hmm.
If you are falling in these any of these categories, see, the this kind of a precaution, it has to be more at the level of the treating doctor, more than
Okay.
what the patient can do. Once
Right.
it has happened, it has happened. It has already happened in the hospital before you go home.
Hmm.
So the treating doctors and all of us are following these precautions, in spite of which it is happening. So the main precautions would be, yes, to use steroids very, very judiciously, only in the indicated people who are having some fall in oxygen levels, who are having desaturation, who
Hmm.
require steroids for overcoming the stress on the lungs, if I
Right.
may put it that. Number one. Number two, the adequate or the judicious use of steroids at the minimum possible levels will also prevent, the formation or the uh, consequence of diabetes even in normal people.
Right.
So we can prevent diabetes in people who are not diabetic before COVID. They end up with diabetes because of high steroid usage. So
Hmm.
steroid usage has to be controlled in the hospital settings. Number two, we will have to keep very strict control on the sugar levels. The
Okay.
thing is, it's again a dilemma, because the doctors are trying to save the life. So at
Yes.
that time, we have to do our best to see that the life of the patient is saved, and we end up sometimes, being more cautious, and we will give some medications which cause side effects, and these kinds
Hmm.
of complications happen, where sugar levels sometimes are not able to be controlled. They continue to be high even after discharge. So we have to monitor the sugar levels, and the patients themselves should be aware that, they have ended up with a new problem like a diabetes after treatment. So they have
Hmm.
to continue anti-diabetic treatment. And sometimes we are also advising patients after discharge who have been in this category, they can use good saline washes. So
Okay.
washing the nose with saline
Hmm.
helps to clean off the accumulated dead fungus, if it is there, before it gets an opportunity to go inside the nose and attack the linings.
Right.
So good control of sugar levels, very minimal and optimum use of steroids as required. See, where it is required, we have to use it, because it's the question of saving their life. So we
Absolutely.
should try to keep it at the optimum level so that we are able to achieve the results without leading to any hospitalization induced diabetes. And
Hmm.
monitoring the sugar level, use some saline washes to keep your nose clean, and you can do some steam inhalation to keep your nose clean. But in spite of all that, the main thing is, if you are falling in the category of the risk
Hmm.
factors, then you have to be aware any new changes like facial pain, nose pain, jaw
Hmm.
pain, or any change in the color of your nose, or any swelling in the eye, any pain in the eye, any unexplained headache, or sometimes even inside the mouth, we have seen in the palate and the mouth, you start getting black particles forming. Any changes you see, any discomfort in your face and head and neck region, immediately you should seek attention and get yourself examined.
Okay. Okay. Doctor, as we know, the situation is very tense, and we do not, intend to spread any fear. But how deadly is this infection? Because, as I mentioned, 90 people have died across different states. So, how deadly is this black fungus infection?
See, we have seen in the last 2 months about 8 to 10 patients
Hmm.
in our hospital alone,
Right,
and they have been in varying degrees. So the risk of death or mortality is as high as 50%.
right, and that is
So
alarming.
again,
Yes.
who falls in the success rate, who falls in the failure rate depends on how early we have picked up. So some of the patients who have recovered and have completed amphotericin and are doing well are the ones who have been picked up in the early stage, both
Hmm.
by the patient's awareness of seeking attention as well as the doctor's awareness of picking it up, doing a surgery,
Hmm.
cleaning up all the fungal infection, and starting immediately with injection amphotericin, and they do well. But those who have been delayed in their own recognition and coming for seeking medical attention, it has spread all over the eye. The vision is gone. Sometimes it has led to blindness. And
Yes.
if it has spread into the brain areas, which we call as a rhinocerebral mucormycosis, there are different types.
Hmm.
Just sinonasal, it is the earliest. It is only in the sinus and nose. Then it becomes rhino orbital, that is the eye is involved. Then it becomes rhino-orbito-cerebral. Cerebral means it's gone into the base of the brain. Those are
Yes.
the patients who have higher risk for loss of life, unfortunately.
Absolutely. Doctor, 1.5 years into this pandemic, and we've seen reports, we've seen visuals where patients are still, scrambling for basic medical essential resources. How prepared do you think our healthcare system is for something like a black fungus, especially during COVID? Because
Yes.
a lot of states have
See,
reported shortage, right from the national capital to Maharashtra, Telangana, several states.
yeah, see, this is more of an administrative question. So I will be able to give you a very basic bird's eye view. What is happening
Sure.
right now is mucormycosis was always there. We have seen mucormycosis before COVID also. That time we
Right.
used to see maybe 5 in a year or 4 in a year. Now we are
Okay.
seeing 3 to 4 in a day. In fact, it's increasing day by day. Even I joined the meeting little late because I was actually seeing 2 or 3 mucormycosis cases in our ICU right away. And we are not fully prepared because the volume of cases is phenomenal compared to the availability of medications. See, the hospital system is already overwhelmed with COVID patients and COVID related care. On top of it, now those who have been discharged, they are seeking readmission. So definitely we are still in a little helpless situation, if I may put it that way.
Absolutely.
And
Doctor,
one is
before.
the
Hmm.
treatment part, and secondly, yes, as you mentioned, the availability of amphotericin injections is going into a dire shortage,
Yes.
and the government is trying to do its best because when the numbers are phenomenally high for a country like India, and this is actually the beginning, as the number of cases are sliding down, that means recoveries are increasing. This is the post recovery problem, so we are going to see more and more of it. I have no answer right now as to how much we'll be able to solve the
Yes.
problem, but yes, we're trying our best.
Right. Doctor, before I end it, are there any tips or suggestions for our viewers and people who will be watching this interview to stay safe and be healthy during COVID? Not just related to black fungus, but in general.
I've got See, it's become very, very simple now. There has been only one consistent guideline which has helped throughout. It is maintaining distance, have good social distancing within the house. Also, there is no harm if you sit 6 feet away from each other.
Hmm.
Number two, mask at all the time. Inside the house, you are okay, fine. But the moment you step out, it is like wearing the rest of your clothes. Wear a mask. It is one thing which has consistently saved people. Just like you say seat belts while driving, now it is
Yeah.
mask while getting out of the house. Hand washing before and after contact with anybody. Please wash your hands. It's become a ritual. It is very, very effective because nothing else other than your hands, which when you touch your nose or
Yes.
mouth, it is going to infect you. So social distancing, Definite use of mask whenever you are stepping outside the house. Maintain 6 feet distance from anyone and everyone. Wash your hands with sterilium. Always carry one in your bag. And now the latest thing is, wherever, whichever vaccine is available, please take it. All of
Right.
them have reasonably good degree of protection. Do not think whether I'm going to get Covishield or Sputnik or Covaxin. Whichever is available near your house, have one. At least have one. Wait for the turn for the second one. Get it done. And we are seeing in the hospital, definitely vaccinated people are having extremely less incidence of COVID, and this is definitely going to help us. So,
Absolutely.
vaccination is a must. Do not hesitate. There are no dangers of vaccination. The benefits are far, far more than the proposed or the propagated risk factors, which are very, very minuscule. We are definitely seeing in the hospital setting, all these factors are the ones which are deciding who is coming for COVID and who is not coming for COVID problems.
Absolutely. Absolutely, doctor. I'd again like to thank you, doctor, for taking out time and speaking to me. These are difficult times, and it's important to be safe, especially when there are new infections and new, viruses and new strains coming up. So it's important to be safe. Thank you so much for taking us through the details of black fungus. Thank you so much.
Thank you. It was a pleasure, and you're all doing a very good job. Congratulations, and thank you for having me.
Thank you so much.